Hi, it's Michelle from Movement Lesson. I don't think people realize how much I teach. Teaching is what I like to do because I'm a helper. I like to help people. This isn't an ideal video because you're seeing it from a different angle, but this is what I do during my sessions. I continue to teach parents. Parents have to understand and know where their child is at and where we can help with their development and where they can help with their movement. And sometimes it's structural, and sometimes it's cognitive, and sometimes it's environmental. And it's important to know that you are here to learn how to help your child on a daily basis, not just during visits for a therapy session. Movement Lesson is about bringing it into your life because it's a lesson in movement. And again, I just thought you'd like to see this, just an outtake from being with one of my clients. Thanks. When your baby is first born, right? First of all, every bone in the cranial system is unattached. Most people think of the soft spots or the fontanelles, the anterior, posterior, but they don't realize that even the forehead. So all your developmental movement is meant to happen prior to skull fusion, right? So, but when the child's intubated, it's usually an emergency. They'll whip the head back to this and they'll line, so they'll usually bring the child off the table, not to get too graphic, but here, so it's aligned, and they'll insert the tube. Sometimes the tubes don't fit right, depending if they're primaries or whatever, that kind of thing. And then what they do is they tape around here, so that's where you get a lot of kids have the inner fangs, kind of, and that's another way I can tell they've been intubated. And they'll lie them like this and back, so the tubing can stay inserted into the airway and make that happen. Right? So what I'm talking about here, and I don't mind if this guy's pulled apart. So here's your skeletal system. There's that white bone in here. I'm going to take it out. So here's just your front. This is the ethmoid. It's a nice little walnut, right? But it attaches to everything. It attaches to your sphenoid, your palatines, your maxillaries. It attaches to every. So what my concern is, what I believe between that and the NG tube, and of course this doesn't move. I can get it to split, but this has been jammed. It's this bone here within the nose.
Okay.
Right? And so that jam goes up and it spreads the nose out. So he almost has, like, I hate to say it, like a boxer's nose. You know what I mean?
Yeah.
And so they like to jump right away and assume genetics, because if there's dimorphic features, they will look in that thing. But that's what I believe. If you could see here again with my baby, but like I said, that we have 5 eyes and stuff, and his brow is like and up, so it's been jammed, because that's all soft tissue, and it's like I said, nothing's attached when they do this. So what I want to do is go in and actually try to start moving his nose and see if I can, in a sense, get that movement back and to unjam it.
Because he's like,
right.
Okay. Yeah,
Right.
it makes sense.
And that's why too, that's what the tongue and the spit is more like, because again, the brow is out. So at the age of 3 now, the face will start going forward, and by the age of 8 now, the face starts dropping down. But that's where you get a bit of an atlas jam in the back with this, and then an ethmoid jam with that bone.
Okay.
So that's where I would like to start concentrating on. However, I would just like a clearer picture of his vision. Is his vision structurally off because of the ethmoid jam, which it could be totally, or is it also structurally off because of that he just needs glasses? You know what I mean, or something like that.
Sounds
That
good.
he has an astigmatism.
Okay.